One of the most common things that I get asked by my patients is, "Doc, my knee still hurts. Why is that? I've been to providers and I'm still having problems." So unfortunately, one of the simple answers is, well, some docs suck. Here, we're Bad Method Fitness, and I'm here to hopefully give you some information that can help you moving forward. When we look at knee problems, there are three things to consider when it comes to treatment. Number one, do we have the right diagnosis? Number two, do we have the right treatment? And number three is, do we have those two things in conjunction with each other? Because if either one of those are off, you're not going to get a good result. So in the nearly 30 years that I've been in practice, the most common things that I see that affect the knee do tend to come in three different areas. The first is degenerative. So as we get older, we tend to lose the spackle, which is the lining that is on the outer point of the bone itself. That spackle is called cartilage. When that cartilage begins to wear away, that creates pressure differences and balance differences inside the joint. That can then cause damage changes to the little cushions that live between the bone above and the bone below, and that little cushion is called the meniscus. So we can talk a little bit more about meniscus tears in a little bit, but many times they are degenerative, which means that the meniscus is breaking down those balance indifferences. Those can end up causing fluid inside the knee, and that can then end up leading to pain and discomfort with walking, climbing stairs, doing any day-to-day activity. The next condition that we oftentimes will see is just a standard biomechanical one. So let's say that the knees are off kilter because they angle in too far or they angle out too far. Some of that can actually be because there's been a degenerative problem or because there's other issues, whether it's going on at the hips, the knees, the feet. And those are things that have to be addressed individually. You can't just look at the knees and say, well, the knees look bad, so I'm only going to try to address the knees, when really the problem is at the hips and at potentially the ankles. Many times when we see that people have knees that are bowed outwards, that tends to be a much more common degenerative issue, and we have to try to address that as well. And one of the third things that we'll see is just the standard meniscal tears. So typically those will happen in individuals maybe under the age of 45, 50, whereas the degenerative stuff tends to hit you more over the ages of 45 or 50. These things can come in combination. You could have mechanical reasons that led to the problem in the first place. So let's talk a little bit about what we're going to do if you have any one of these problems. In almost every case, you have to look at a physical therapy approach before we start talking surgeries, injections, things along those lines, unless under certain circumstances, it may not be unreasonable to consider those, but I'll talk about those in a minute. Most important is that we look at the balance of the whole lower body, including the core. So the proper physical therapy program, everything is strong at the core, the hips, and the knees, as well as the lower parts of the legs, is absolutely crucial to having the right physical therapy program. You need to work with people who understand your particular mechanics, address those mechanics, those strength deficits, which can include physical therapists as well as personal training, which is why I am now running a program that focuses on the physical therapy, the personal training side, to get you back into your program. You also need to make sure that whatever equipment that you're getting onto, make sure that it fits you instead of you trying to fit it. So therefore, it might need some modifications of the equipment that you're using to make sure that you're doing this right. So that's one of the important pieces when you're just dealing with degenerative, whether you're dealing with meniscal or you're dealing with some biomechanical problems. Other things that can help in terms of the biomechanics in getting onto the right piece of equipment, making sure that that it fits you instead of vice versa, is sometimes just having good shoes, good inserts. Some people believe that you can rebuild your arch through muscle strengthening. I think it's very hard as you've gotten older to be able to do that, but that is something that we still try to address through physical therapy. Once you've gone past the physical therapy, there might be options of bracing or using wedges in your shoes, things along those lines. We try to use those as temporary measures or taping techniques. We try to use those as temporary measures while you're doing your exercise through the rehabilitation program so that you can then build to be ready for exercise. Other things to consider is whether we should be using injections. I only use corticosteroids or quote cortisone injections when I need to get somebody back into action as quickly as possible because they can't do the rehabilitation program, or they've been through rehabilitation and they still have significant irritation inside the joint. That might be a time to use steroid. But we'll oftentimes use other things that are less dangerous to the joint. We know that steroids will affect the joint. It will actually cause more harm than good in the long run, which is why we often use things like dextrose prolotherapy to help with pain control, much less toxic to the joint. Many times we'll use the gel injectables or the viscose supplements. We might also end up using something like a plasma or a stem cell. That's a whole other discussion, but it's important to recognize that we use these things to try to get you going when we've already done the exercise program. These are not the kinds of things that we address right away and say, hey, here's your stuff. Let's not worry about the therapy. And surgery obviously is a last option once we've done our imaging, once we've had you go through all this stuff. So from my perspective to you from Bad Method Fitness, the most important thing that we need to address when you've got a knee issue or really any other issue is, did your clinician get you the right diagnosis? Did they get you set up on the right therapy, get you all the right stuff that you need to make sure that you're as healthy and as fit as you can possibly be? And then did they look at your biomechanics? Did they address your problem, not just a global one that they treat every day and put you through a cookie cutter treatment program? So that's my advice to you. I'm Dr. Davis from Bad Method Fitness, and I hope that was helpful for you. We'll see you again sometime soon. Take care.